Hi, here we are at EULAR Congress 2025 with Dr. Antonio Tonutti from University of Milan Humanitas. I am Maria Iacovantuono, the young investigator member from University of Vergata, Rome. Hello, Antonio. Nice to see you again.
Hello, Maria. Nice to see you.
Would you please give us some insight about your recent analysis on EUSTAR database for risk of developing cancer in patients with systemic sclerosis? Which are the correlation with disease phenotype and the prognosis?
Thank you very much for your question, Maria. It will be a pleasure. So, what we saw in our EUSTAR study was that we wanted to investigate the very risk factors for cancer in patients with scleroderma, because we know that proven risk factors have been already elucidated in literature, but these are only directed to a very small and defined subset of patients, which is the one with anti-RNA polymerase III autoantibodies. Whereas we wanted to investigate different risk factors at different time points to see, in particular, if we can be able to intercept patients who develop cancer synchronous to the onset of scleroderma or during the follow-up. What we saw was that we were able to explore serological risk factors, as is the positivity of different autoantibodies apart from RNA polymerase III, and selected disease characteristics. And the interplay between these two features was particularly associated with cancer that we can intercept during the follow-up of patients with scleroderma. Also, we investigated the impact of a cancer diagnosis on the disease trajectory of patients with scleroderma, and we saw that it is particularly interceptable cancers, so cancer that we can early diagnose in our patients that impact on the prognosis of scleroderma patients.
Hello, thank you, Antonio. Very nice results. And do you have suggestion about screening?
This is a very relevant question because at the moment, the only available screening recommendations are directed only to this very small and defined subset of patients with anti-RNA polymerase III autoantibodies. Whereas data from this EUSTAR study are telling us that we need to improve our screening strategies, and maybe that leveraging machine learning models, as we tried in our study, but required further validation in independent cohort, leveraging these models, which are able to make predictions independently from the linear distribution of data. These models could provide us novel insights.
Thank you, Antonio.
Thank you very much. It was a pleasure.